there people outside?
Yeah, I'll hold her
Or
up.
call them, please?
What we're gonna be doing is, instead of.
What's your lunch? Just a sec. Okay.
Okay, we're doing a case study on type 2 diabetes, and this is our profile, Jerry's profile, and he's a math teacher and in a local middle school, so you can imagine how stressful his life is, and he probably doesn't get too much exercise because of checking all those papers, and so this is, he has type 2 diabetes. He was diagnosed for type 2 diabetes 4 years ago, and his BMI is 31.6 at that time, but then he went on because he did some exercise later on. But he also have asthma, so besides diabetes, he have asthma, and so that's giving him a hard time doing exercise because he's having a hard time breathing. Okay, and then here's the breakdown of the normal. This side are the normal profile. The other side is Jerry's profile, and this one are the normal that he's supposed to have. And we could see his glucose is elevated, the LDL is elevated also, and the HDL. We want the HDL to be lower, and we could see, higher, so we could see that his is lower, and his triglyceride is really high, and his blood pressure is also a little bit high, and so he's into having high blood pressure later on, and because of his job is very stressful, that could be, it's gonna get higher and higher. And one thing also, most of the medicine that a person that's taking with diabetes, there's also a side effect that person could have a hypertension. And the ALT and the AST are the test for his liver function, and we could see that it's still within the range, but the AST, he's on the borderline at 39, and the maximum on AST is 40, so he's not having any liver problem at this time, but probably could happen if he doesn't change his lifestyle. And again, his BMI at this time is 29.5. And what is diabetes? We have a type 1 and type 2 diabetes, and these are the difference that we found out. For type 1, mostly for young children, and they're underweight, and for type 2, mostly are for obese and older person. But the pathophysiology for both are almost similar. We can see right here, beta cells are being destroyed. Same thing on this one. There's also problems in insulin. And another difference is this person right here on the onset will be taking insulin right away, and this one, they still have they could still be taking medicine, and they could be probably taking insulin later on. Okay, some of the symptoms of Jerry was experiencing is this one here, liquid urination, and he's having a UTI, and he also started to have a blurred vision. And again, his also his blood pressure was need to be maintained. And these are the current statistics. We know that 90% of almost 90% of have diabetes is either a lot of people are having a diabetes, and most 10% are only type 1. The rest of the percentage are type 2. And it says here that 7 million people are unaware of it because we don't feel it until later on when we have it already. So it's not something that you see bruises or something hurt. It doesn't hurt until you just unless you're always having a checkup on your glucose. And here's the pathophysiology of type 2 diabetes. We have the insulin sensitivity, cell damage, impaired regulation of hepatic glucose production, and the possible beta cell failure. And we're going to explain the complication.
Let me go back. First slide here. So continuing on with Jerry's profile, as you know, he has at the time of the diagnosis, he has asthma, and he got on strict diet and exercise regimen. That's why he lost 20 pounds. And he started on metformin, which is the medication for type 2, or generally, was it for both, or is it just type 2? Not
Type 2.
Type 2, okay. Medicine for type 2 diabetes. And they have a list of medicine for type 2 later on that includes that. And so the blood sugar and A1C improved in 4 months. 2 years ago, the test showed that there's an increase in A1C, and we're going to explain A1C later on. That is from 6.2 to 7.3. More medication was added, like glimepiride, which is the Amaryl. His asthma is controlled by inhalants. That includes Advair and Singulair. Last year, his asthma got worsened, prednisone is added, his has been exercising less, and because of that, he gained 50 pounds. And his current weight is 205, which gives a BMI of 29.5, and that is borderline obesity. A1C rose to 8.5. Blood sugar is 220. UTI, his UTI is recurrent. He complained of increased blurry vision. This is his profile that includes lipid, all this total cholesterol is 194. LDL cholesterol is 120. HDL cholesterol was 31, and triglycerides 220. They're all abnormal, and later on there's going to be a recommendation by the expert on what the normal range and what he should be on. Cardiovascular, he has high cholesterol, low HDL. With the eye exam, there's no cataract, no glaucoma, but he has an early sign of retinopathy and neuropathy. He has signs of peripheral neuropathy, difficulty in emptying urinary bladder, occasional diarrhea, and impotence. His blood glucose on the fasting is abnormal, and all of these are abnormal pre-meal and post-meals. Okay, like she said, he is hypertensive because he has this 135 over 90 of blood pressure. Liver function, she mentioned that earlier. risk is some groups have a higher risk for developing type 2 than others. More common in African Americans, Latinos, Native Americans, Asian Americans, Native Hawaiians, and other Pacific Highlanders. And this is part of the physiology of diabetes, and these are the conditions that puts people at risk of diabetes metabolic syndrome, or sometimes it is known as syndrome X. But this condition that increase in morbidity and cardiovascular disease among people who are obese or have diabetes type 2 and prediabetes. I'll give definition of prediabetes later on. These are the characteristics of metabolic syndrome. Insulin resistance, a phenomenon in which the insulin receptors are unable to respond to insulin produced by the body. And so in response, the pancreas produces large amounts of insulin to keep blood sugar under control and to overcome the cell's resistance. As more insulin is produced, the pancreatic beta cells wear out, resulting in high blood sugar levels, and this is what is known as prediabetes. Abdominal obesity, we have to have a waist to hip ratio of more than 0.9 in men, and that is for women. In this case study, he's a man, and he has a BMI of right around close to this in order to be called abdominal obese. Lipid abnormality, high triglycerides should be above 150 in order to be abnormal, and low HDL cholesterol is less than 35, which in his case, they're both abnormal. And he's, like she said earlier, she's pretty hypertensive because he's not yet hypertensive. He is pre-hypertensive. It's fasting glucose is this or higher. Microalbuminemia, microalbuminuria. Okay, so it has albumin to creatinine ratio of 30 milligrams per gram and albumin excretion rate of 22. These are the complications of diabetes. We divided it into two types: micro vascular complications, and that's micro. And what includes in the microvascular complications are diabetic retinopathy, which is the leading cause of blindness in the U.S. And there's two types of retinopathy. And the one that says, okay, this one is non-proliferative retinopathy, is the one that results from leakage from the blood vessels into the macula, causing the blurry vision, and that's what Jerry has. That's why he complained of increased blurry vision. And the proliferative retinopathy is more serious kind of retinopathy, because it results from a normal growth of blood vessels distorting the retina of the eye. Neuropathy, about half of diabetics are affected with neuropathy, and over time, excess blood sugar can damage the walls of the tiny blood vessels that nourish your nerves. And most common type is called peripheral neuropathy, and the symptoms are tingling, pins and needles in the feet and hands. Sometimes there's pain or increased sensitivity, numbness or weakness. Nephropathy, that's kidney. So high levels of blood sugar makes the kidneys overwork, and because these nephrons lose their filtering capacity, over time they start to leak, and you useful proteins are lost in the urine, and that's called microalbuminuria. Then at the latter stage, when large amounts collect in the urine, which is called macroalbuminuria, end stage renal disease or SRD can occur. On the macrovascular complication, that includes CVD or cardiovascular disease, which is the most common cause of death for people with type 1 and type 2 diabetes, more likely to afflict people with diabetes than the general population. Lipids and cholesterol can build up along the walls of the blood vessels and lead to atherosclerosis, then can lead to heart attack. Stroke, it's like heart attack, but it's in the brain. And stroke occurs when blood no longer leaves the brain. Liver disease that includes cirrhosis and liver aortosis, another organ that diabetes can damage. So, but there's no exact known for how liver is being damaged by the diabetes, but it may be related to insulin resistance or obesity. So monitoring and treatment. Prevention first. The primary strategy is the prevention of complications. So we have to have, one has to, people with diabetes should control their blood sugar. Make sure they keep blood sugar within target range. Use glucose meters. Keep daily log of blood sugar levels. Respond immediately if there is a hyperglycemia, which is high blood sugar, or hypoglycemia, which is the low blood sugar. Check for ketones, reduce this, controlling the blood sugar, reduce risk of microvascular and macrovascular complications and albuminurias. A1C, this can assess how well your blood sugar, how well your diabetes is controlled for 2 to 3 months. And this test measure, there it is. Okay. This measure your average blood sugar for the past 2 to 3 months, gets an overall picture of how well your diabetes is controlled. Does not replace the daily self-monitoring method, so you have to do these two at the same time to do this. ADA recommends to aim for A1C below 7 if you have diabetes. Blood pressure control. As many as 2 out of 3 adults with diabetes have high blood pressure, which is what is known as hypertension. This raises the risk of heart attack, stroke, eye problem, kidney disease. Gotta check the BP regularly, and if you're smoking, quit smoking. Reduce the risk of CVD, which is a cardiovascular disease, by monitoring and regulating blood pressure and blood lipids. American Diabetic Association and National Institutes of Health recommends to target blood pressure to below 130/80. LDL cholesterol of less than 100, triglycerides less than 150, HDL cholesterol more than 40 for men and more than 50 for women. Monitoring continues. Food exam. Diabetics should make sure that they check their food and examine their food once a year, and the clinic they'll check their skin, injuries, sores, blisters, and other problems. They have to have regular eye exam, kidney checkup, dental hygiene, or lifestyle change, lose weight, maintain healthy weight. That's what Jerry has to do as well. We increase the exercise DVD so he can lose weight, make all this change, lifestyle change, do all of that, eye exam, make smart food choices, may need to go see a registered dietitian for consultation, take blood glucose control medication as prescribed, take pills such as ACE inhibitors. All this monitoring process can help detect complications sooner and delay having to resort to other serious forms of treatment such as coagulation and vitrectomy for retinopathy and dialysis or kidney transplant. So these are a list of all the medication for type 2. Here is alpha glucosidase inhibitors, exaltide. I'm not going to read all of that, but down here is what Jerry's taking, the metformin, which is the glucophage, it's called the name, and what it does, it decreases the liver's glucose output and increases the muscle's glucose intake, but there is a side effects, which is the nausea and upset stomach with diarrhea, and that's what he has. He has occasional diarrhea, probably due to side effect of the metformin. And so he's also taking pyrite amaryl, which is the sulfonylureas, and what it does, it stimulates insulin production by the pancreas, and it has side effects of hypoglycemia, low blood sugar. And that's it.
All right, let's give them a hand. Okay, so insulin is one of the hormones we're going to be talking about on Tuesday that have to do with digestion, and our focus is going to be Tuesday mainly on the levels, the effects of these various hormones on the levels of blood amino acids, blood glucose, and fatty acids. Many of them, insulin and thyroid hormones are the only ones that actually lower blood glucose levels. All the other ones are going to elevate blood glucose.